Alright, the first muscle is the trapezius. That is right here in this area. And up here. The main movement for the trapezius is elevating and depressing the scapula. The origin is right here, and the insertion is here. The two bones that it attaches to are the clavicle, through here, and the occipital. And the joint is the acromioclavicular joint, which is right in here. And the concentric movement for this muscle would be elevating. And then the eccentric is depressing. And this is the forceful movement, so elevating. And this is the stretching movement, which is depressing. The next one is the biceps brachii. This one, the main movements is to extend and flex the arm. The bone it's attached to is the scapula and the radial tuberosity. The joint is the elbow joint. And the concentric movement for this is flexion of the arm. And then the eccentric is extension of the arm. This is the forceful movement, and this is the stretching movement. The next one is the triceps brachii, same thing. The main movements is extension and flexion of the elbow or the arm. The bone is the scapula and the humerus, so up here, and then the humerus, which is down here. The origin is up here, and the insertion is down here. The concentric movement for this would be extension of the arm. That is the concentric movement. And then the eccentric movement is flexion of the arm. So this is the forceful movement, and this is the stretching movement. The joint is also the elbow joint. And then the latissimus dorsi, that is your back. That would be in this area through here. The bone it is attached to is the T1 or T7 through T12, ribs 8 through 12, the iliac crest, and the humerus. The origin is back here in the middle through T7 through T12, and then the insertion is up here on the humerus. The joint is the vertebrocostal joint, which would be right beside, kind of by the origin. That is in between the vertebrae and the ribs. The concentric movement for the latissimus dorsi would be adducting your arm towards you. So that is the concentric movement. And then the eccentric movement is bringing your arm away from you, so abduction. And then this would be the forceful movement, which is adduction. And then the stretching movement would be abduction for the latissimus dorsi. And then we have the flexor carpi radialis. That is right through here. The bone is the humerus and metatarsals 1 and 2. The main movement for the flexor carpi radialis is to flex and extend the wrist. That is the main movement. The concentric movement is flexing the wrist or the hand. That's the forceful movement. And then the eccentric movement is the restraining and extension, or that is also the stretching. Restraining extension is the eccentric movement, and the stretching movement. The joint for the flexor carpi radialis is the radiocarpal joint, which is in here. Next is the palmaris longus, which is also this way, and it goes up through here. The bones are the humerus and the palmaris aponeurosis, or palmar aponeurosis, sorry. The main movement for the palmaris longus is also flexing the hand and extending the hand. The concentric movement is flexion of the hand, that is the forceful movement, and the eccentric movement is extending the hand this way, and that is also the stretching movement. The joint is the intercarpal, which is in this area through here. And then we have the deltoid, which is right here, your shoulders. The main movements for that is to abduct the arm, to medially rotate, laterally rotate. You can flex the arm, extend it. The bone is the clavicle, right in here, and the humerus. The origin would be up here, and the insertion would be right here. The joint is the glenohumeral joint, which is right kind of in this area. The concentric movement for the deltoid would be medially rotating the arm inward. And then the concentric movement would be laterally rotating the arm outward. That is eccentric, and then this is concentric. Medially rotating is concentric, laterally is eccentric. And this is also the forceful movement, and this is the stretching movement for the arm. And the last muscle is the supraspinatus. The main movements for that is abducting and adducting the arm. That's the main movement. The supraspinatus is right underneath the traps, under through here. And the origin of that is right here, and the insertion is here. The two bones it's connected to is the humerus, insertion, and the scapula, which is the origin. And the joint for this is the acromioclavicular joint, which is also right here. Same for the traps. The concentric movement of this one is abducting the arm, that's concentric, and then adducting the arm is eccentric, so bringing it down through to your body. The stretching movement would be adduction, bringing it towards you, and the forceful movement would be bringing it away from you, so abduction, that is the forceful movement. So we have the gastrocnemius, which is right here. The two bones it connects to is the calcaneus, which is right here, and the femur, which would be right here. That would be the insertion, and that is the origin. And the concentric movement of the gastrocnemius would be plantar flexion, which is this, and the eccentric movement is dorsiflexion, which would be doing this. And the joint, which is right here, is the talocrural joint, and that is a part of the heel. And the next one is the extensor digitorum longus, which is right through here, more on the outside than on the middle. And the two bones are the phalanges of toes 2 through 5, which is right here. And then the tibia and the fibia, which are those are in your bottom part of your leg. The concentric movement would be dorsiflexion, and the eccentric movement would be plantar flexion. And on the gastrocnemius, the forceful movement would be the plantar flexion, which is doing this, and the stretching would be doing this, which is dorsiflexion. And for the extensor digitorum longus, the forceful movement is dorsiflexion, and the stretching movement is plantar flexion. And the joint is the intertarsal joint, which is right here. And then there is the tibialis anterior, which is directly beside it, which would be more in the front than right there. And the bones that it connects to is the tibia and the metatarsal one. The concentric movement of the tibialis anterior is dorsiflexion, and the eccentric is plantar flexion. This is the origin of the tibialis anterior, and the insertion, which is right here. And the joint is the tibiofibular joint, and that is right in here. And the forceful movement would be dorsiflexion, dorsiflexion, and the stretching movement would be plantar flexion.